Ever wondered, what is asthma? Well, today we're going to demystify this common but often misunderstood condition. Asthma, in its simplest terms, is a chronic respiratory disease. This means it's a long-term condition that affects the airways in your lungs, causing them to become inflamed and narrow, and making it harder to breathe. Asthma is a global health concern, affecting millions of people around the world, from little ones in their early childhood to adults in their golden years. It's a condition that doesn't discriminate, impacting people of all ages, races, and walks of life. But here's an important point to note. Asthma isn't contagious. You can't catch it like a cold or the flu. It's a condition that's unique to each person, with different triggers and symptoms, and requires personalized management strategies. So, are you ready to dive deeper into the world of asthma? Great, let's go. To begin with, let's examine the causes of asthma. Asthma, a chronic disease that inflames and narrows the airways, is typically caused by a combination of genetic and environmental factors. It's a bit like a lock-and-key situation. Certain people are predisposed to asthma, meaning they have the lock, but it's the environmental factors that act as the key, triggering the onset of the condition. Now let's talk about these genetic predispositions. Researchers have found that certain genes associated with the immune system and inflammation are more common in people with asthma. So, if asthma runs in your family, you might have inherited a genetic tendency towards hyperreactive airways. On the other hand, environmental factors play a crucial role in unlocking this genetic predisposition. These factors are varied and can include exposure to allergens, such as dust mites, pet dander, pollen, or mold. These allergens can cause an immune response that leads to inflammation and narrowing of the airways, the hallmark symptoms of asthma. Respiratory infections, especially during early childhood, can also contribute to the development of asthma. These infections can damage developing lung tissue, leading to long-term changes in lung function. Physical activity is another trigger that can induce asthma. This is commonly known as exercise-induced bronchoconstriction. But don't worry, this doesn't mean you should avoid exercise. On the contrary, regular moderate exercise can help manage asthma symptoms over time. Exposure to cold air is another common trigger. Cold air can cause the airways to contract, leading to an asthma attack. Similarly, emotional stress can also trigger an asthma episode by causing rapid breathing and tightening of the airways. So, as we've seen, asthma is a complex disease that involves both our genetic makeup and our environment. It's a constant dance between our genes and the world around us, with each one influencing the other. Now that we know the causes, let's move on to understand how asthma manifests itself. So, how does one recognize asthma? Let's explore the symptoms. Asthma, a chronic condition affecting the airways, can manifest in several ways. The symptoms can vary from person to person, and they can even change over time. However, there are a few common signs that may indicate the presence of this respiratory condition. One of the most typical symptoms is wheezing, an unusual, high-pitched whistling sound that occurs while breathing. This sound is produced when the inflamed, narrowed airways restrict the flow of air. It's especially noticeable when exhaling, and it can sometimes be heard without the use of a stethoscope. Next, we have shortness of breath. People with asthma often feel as though they can't get enough air into their lungs. This can happen during physical activity, but also at rest, and it's often worse at night or early in the morning. Chest tightness is another common symptom. It feels as though something is squeezing or sitting on your chest. This can be a frightening experience, and it's caused by the muscles around the airways tightening up, a phenomenon known as bronchospasm. Lastly, coughing is a frequent symptom, particularly at night or after exercise. This isn't your average cough. It's often chronic and can be dry or mucus-producing. This coughing is the body's way of trying to clear the airways. Remember, not everyone will experience all these symptoms, and they can change over time. Some people may only have one or two of these symptoms, while others may experience all four. The severity of symptoms can also vary, from mild and almost unnoticeable to severe and life-threatening. It's also worth noting that these symptoms can be seen in other respiratory conditions as well. So it's crucial not to jump to conclusions. If you or someone else is experiencing these symptoms, it's essential to seek medical advice. Recognizing these symptoms is the first step towards diagnosis. Let's see how medical professionals diagnose asthma. Diagnosing asthma isn't always straightforward. Let's see why. Asthma, as you may know, is a chronic condition that affects the airways, causing them to be inflamed and narrow. The diagnosis of this condition is not as simple as ticking off a checklist of symptoms. It requires a comprehensive approach with a detailed medical history, physical examination, and lung function tests all playing a crucial role. Now, why the need for a detailed medical history, you might ask? Well, understanding a patient's past health experiences, their family's health history, and their environmental exposures can provide valuable clues. This information can help assess the likelihood of asthma and rule out other conditions with similar symptoms. The physical examination is another critical piece of the puzzle. Here, the doctor looks for signs of asthma such as wheezing, coughing, or difficulty breathing. But remember, the absence of these signs during the exam doesn't necessarily mean asthma is off the table. The symptoms of asthma can be intermittent, appearing during certain times or situations and disappearing at others. Next up, lung function tests. These tests measure how much air you can breathe in and out and how fast you can exhale. One commonly used device is the peak flow meter. This handy tool measures how hard you can blow air out of your lungs. Lower than normal peak flow readings can be a sign of inflamed and narrowed airways, typical in asthma. Another important lung function test is spirometry. This test measures how much air you can exhale after taking a deep breath and how fast you can empty your lungs. If the results indicate limited airflow, it might suggest the presence of asthma. But remember, these tests alone cannot confirm asthma. They need to be interpreted in the context of the patient's medical history and physical exam findings. It's like piecing together a jigsaw puzzle, where each piece adds to the bigger picture. Once asthma is diagnosed, what's next? Yes, you guessed it, treatment. Treating asthma is about managing symptoms and preventing attacks. Let's see how. When it comes to managing asthma, it's a two-pronged approach. The first prong involves long-term control medications, and the second involves quick relief medications. Let's break down these two categories and understand their role in controlling asthma. Firstly, we have long-term control medications, which are also known as maintenance medications. They work, as the name suggests, over an extended period. The primary goal of these medications is to reduce inflammation in the airways, making them less sensitive and less likely to react to triggers. The most common type of long-term control medication is inhaled corticosteroids. Inhaled corticosteroids are not the same as anabolic steroids that athletes use. These are medications that you inhale directly into your lungs, where they work to reduce inflammation and mucus production. This helps to prevent asthma symptoms from occurring in the first place. Now, let's talk about the second prong of asthma management: quick relief medications. These are also known as rescue medications. As the name suggests, these medications provide rapid, short-term relief from acute symptoms. The most common type of quick relief medication is short-acting bronchodilators. Short-acting bronchodilators work by relaxing the muscles around your airways, allowing them to open up for air to flow in and out more easily. This quick action helps to alleviate symptoms like wheezing, coughing, and shortness of breath. It's important to note that while these medications provide immediate relief, they do not address the underlying inflammation like long-term control medications do. While we've covered the two main types of medications used in asthma treatment, it's crucial to emphasize that each person's asthma is unique, and so their treatment plan should be individualized. What works well for one person might not work as well for another. This is why regular follow-ups with your healthcare provider are so important. During these follow-ups, your healthcare provider can assess your symptoms, evaluate the effectiveness of your current treatment plan, and make any necessary adjustments. They can also provide education about recognizing triggers, using inhalers correctly, and understanding when to seek emergency care. In addition, they may recommend other strategies to manage your asthma. These might include lifestyle changes like avoiding triggers, regular exercise, and maintaining a healthy diet. Or they might include tools like a peak flow meter, which can help you monitor your lung function at home. In conclusion, treating asthma is a multifaceted approach that involves long-term control medications to prevent symptoms, quick relief medications to treat acute symptoms, and regular follow-up to ensure the treatment plan is effective. Treatment is crucial, but so is understanding the disease process. Let's delve into the pathology of asthma. Asthma is more than just wheezing and coughing. Let's understand the underlying pathology. At its core, asthma is an inflammatory disease of the airways. Now, what does this mean? Well, let's think of the airways as tiny tubes, responsible for transporting air in and out of our lungs. In people with asthma, these tubes become inflamed and swollen. This inflammation is a result of an overactive immune response to various triggers such as allergens, exercise, or even stress. This inflammation doesn't just sit idly by. It contributes to a series of changes in the lungs that complicate normal breathing. One such change is the narrowing of the airways, a process known as bronchoconstriction. In simple terms, imagine if those tiny tubes we talked about earlier were to suddenly shrink in size, making it harder for air to pass through. This is exactly what happens during bronchoconstriction. But the troubles don't stop there. Alongside this, there's an increase in the production of mucus. Normally, mucus plays a crucial role in trapping and removing foreign particles from our lungs. But in the case of asthma, the mucus production goes into overdrive. This excess mucus fills up the already narrowed airways, making breathing even more difficult. And then, there's bronchospasm. This term refers to the sudden contraction of the muscles that line the airways. It's like if the walls of those tiny tubes decided to suddenly squeeze in, further narrowing the airway. Combine this with the inflammation and excess mucus, and it's not hard to see why breathing becomes such a struggle for people with asthma. These changes in the lungs, the inflammation, bronchoconstriction, excess mucus, and bronchospasm, they all work together to produce the symptoms we associate with asthma. The wheezing, the coughing, the shortness of breath, they're all a direct result of these pathological changes. But it's not just about the symptoms. The chronic nature of these changes can lead to long-term damage to the airways, a process known as airway remodeling. Over time, this can make the airways permanently narrow, leading to a decline in lung function. And that's where the significance of understanding this pathology comes in. It's not just about knowing what happens during an asthma attack. It's about understanding why it happens and the long-term implications it can have. It's about knowing that asthma isn't just a disease of the symptoms, but a disease of the airways. And with this understanding, we can better appreciate the complexity of asthma. We can acknowledge the importance of its management not just to control the symptoms, but also to prevent long-term damage to the lungs. Understanding the pathology helps us appreciate the complexity of asthma. Let's summarize what we've learned. We've covered a lot about asthma today. Let's recap. Asthma, as we've learned, is a chronic condition affecting the airways in the lungs. It's characterized by inflammation and narrowing of these airways, leading to difficulty in breathing. The exact cause of asthma remains unknown, but it's believed to be a combination of genetic and environmental factors. Triggers can vary widely between individuals and may include allergens, smoke, exercise, cold air, and even stress. The symptoms of asthma, while common, can still be quite tricky. They include wheezing, shortness of breath, chest tightness, and coughing. However, these symptoms can vary from person to person and may not always be present. This is why it's crucial to recognize your own unique pattern of symptoms to manage your asthma effectively. Diagnosing asthma involves a series of steps, including a detailed medical history, a physical exam, and certain tests like spirometry and peak flow. The goal is to assess how well your lungs work and determine the severity of your asthma. When it comes to treatment, it's all about managing symptoms and preventing asthma attacks. This typically involves the use of quick relief medicines for immediate symptoms and long-term control medicines to prevent symptoms and attacks. But remember, everyone's asthma is different, so your treatment plan should be tailored to your specific needs and triggers. Now let's touch on the pathology of asthma. It involves a series of changes in the lungs, including inflammation, bronchoconstriction, and airway hyperresponsiveness. These changes lead to the typical symptoms of asthma and can cause long-term damage if not properly managed. So there you have it, a quick recap of what we've learned about asthma today, from its causes and symptoms to its diagnosis, treatment, and pathology. It's a complex condition, but with the right knowledge and management, it can be controlled effectively. Remember, asthma is a manageable condition, and knowledge is your first line of defense. Stay informed, stay healthy.